I'm Babak Mehrara. I'm a plastic surgeon from Memorial Sloan-Kettering Cancer Center. And if you look at the pathology of lymphedema, it's actually fat deposition. So lymphedema becomes untreatable because people deposit fat in their arms. So initially when people have lymphedema, it's really a fluid problem. And that's why it responds to massage and wrapping and things like that. However, over a prolonged period of time, lymphedema is a fat problem because that fluid, it causes fat to accumulate in the patient's arm. For that reason, for example, a very common thing that we do for reconstruction in these patients is liposuction. That's a common method of treatment for lymphedema. So lymphedema and fat are very intimately related. I think, and we think that actually it's well known that the lymphatics can regulate fat deposition. So Guillermo Oliver, who's at this meeting, has shown that if you have defects in your lymphatic system, sort of even very minor defects, those animals become obese when they're adults. So it causes fat cells to accumulate. Of course, we know from lymphedema that happens too. I mean, that's sort of a more acute thing. So I think of lymphedema as regional obesity. I think some women have propensity to put fat in their thighs or hips or whatever. Patients with lymphedema have propensity to put fat in their arm or leg wherever they have lymphedema. So that's what I think of it. I think another point to that is that I think fat is also regulates lymphatic function. So we've shown in our studies that if you take an animal and give it a high-fat diet, that those animals then develop lymphatic problems. They don't clear fluid as well. The immune cells don't traffic as well. So there's definitely a correlation. There was a paper a few years ago from the New England Journal showing that hyper-obese patients develop primary lymphedema, so lymphedema without another cause. There was another paper from the Scandinavians showing that obese patients have impaired clearance of interstitial fluid. So if you inject fluid in the interstitial space, which is where the lymphatics work, they don't clear it as well as lean patients. So there's clearly a relationship between fat and the lymphatic system, and I think it's a two-way street. Bad lymphatics can cause fat to deposit, and fat can cause lymphatics to not work very well. And I think those both come into play in lipedema. The whole hormonal thing, I think that makes sense too. You know, it's actually very difficult to make a premenopausal mouse fat. You can't do it, even though if you can feed it whatever you want. So I think there's definitely hormonal regulation of fat deposition in general, and then that's sort of amplified by lymphatic problems.